There are changes taking place at the Marin County Department of Health and Human Services around maternity services. As of April 1st, the county has stopped accepting maternity patients. New patients are being referred to Marin Community Clinics, and existing patients will be transferred to Marin Community Clinics or other providers by June 24th. This process is similar to the closure of the county's gynecology clinic in 2010.
But that closure is really a realignment. We will be working with Marin Community Clinic such that they will open up their obstetrical practice outpatient services at the same time we close to new patients. And the new hospitalist system at Marin General Hospital will be in place both for Medi-Cal patients and for privately insured patients. The financial model under which the county has operated its services is Medi-Cal fee-for-service, but that is not sustainable. The sustainable model for healthcare of that type is under the federally qualified healthcare system under which Marin Community Clinic and Coastal Health Alliance belong.
When the county decided to step back from directly providing services to pregnant women, what happened was that 4 community organizations came together to try and find a solution for how to continue high-quality services to pregnant women in the county. Those 4 partners were Marin General Hospital, the County of Marin, Marin Community Clinics, and the Prima Medical Foundation. Each of these 4 organizations plays a different role in this process and have different services and support that they can provide. However, really putting the 4 organizations together, we were able to create a system where each piece that is critical for good, high-quality, continuous care during someone's pregnancy will be in place.
It puts medical care and basic reproductive health care for women in their context of their primary care or medical home.
Essentially what was happening before is families would go to Marin Community Clinics, get all of their primary care, but as soon as a woman would become pregnant, her care was transferred to the county. She would stay with the county for 10 months, 9 months, whatever the case may be, and then be transferred back to Marin Community Clinics.
The reason that Marin Community Clinics decided to engage in and provide obstetrical care for patients is essentially this is the last service that we're not providing in our clinics, and we really want to be the comprehensive health provider in the medical home for our patients. So the addition of obstetrical services will bring care full circle and allow families to access our healthcare services throughout their lifespan.
We have very carefully planned this transition of our practice such that there will appear very few differences to the patients that we serve.
Many of the staff are going to be working at Marin Community Clinic, so our clients will still see the same physicians, midwives, and nurses.
So there will be a lot of familiar faces for patients.
In addition to that, the women will be receiving their care in the same physical location as they were previously, because Marin Community Clinics will be running their prenatal clinics out of the same building that the county was previously using.
And many of the policies and procedures are exactly the same.
So I think our clients won't sense a lot of change. They will be coming into the same lobby. They'll just be checking in at a different part of our registration desk.
As with any transition, there can be some little road bumps, but we're really committed to providing this service and making sure everything, all of the services are obtainable as easily as possible for patients.
We are moving towards a system that is both patient-centered and family-centered. We really went into this process believing that families that are either underinsured or uninsured should receive excellent, high-quality medical care. And this care should be continuous throughout someone's life, not interrupted because they become pregnant or they develop some high-risk issue. And that the care for a family should be all in one place, be it a child or a woman or a man. The whole family should be able to receive their care in one setting. That to me is family and patient-centered. It's convenient. It's providers that have your whole history in front of them when they see you, even if you're new to the pregnancy world, the provider would still know all of your history from before. And then, most importantly, because pregnancy is such a common occurrence in a family, we really want there to be a great link to the hospital piece. Women who get pregnant will end up showing up to the hospital at some point during their course, and we really want those providers also to have a very good understanding of who this woman is, where she came from in terms of her prenatal care, and what high-risk issues may affect her course while she's in the hospital.
To learn more about these changes, clients will receive a letter in the mail and will receive more information at their next visit. We also want you to know that midwife services will be offered at Marin General Hospital 24/7 for all Marin women, whether uninsured, underinsured, or privately insured. The clinics remaining at the county's HHS clinics are immunization, tuberculosis, sexually transmitted diseases, HIV, and hepatitis C. Here are links to learn more.